Hello, and thank you for joining today's webinar on the new Foster Youth Independence Initiative. My name is Becky Primo, and I'm the Director of the Housing Voucher Management and Operations Division in HUD's Office of Public and Indian Housing. Our office is responsible for developing national policies, procedures, standards, methods, and administrative requirements for the Housing Choice Voucher Program. Our public housing agencies, which are the instrumentalities that administer the voucher program, administer voucher assistance to over 2.1 million individuals and families. Today, we're here to talk about an exciting new initiative that was launched on July 26th. That is the Foster Youth to Independence, or FYI, initiative. Essentially, through FYI, HUD is offering the opportunity for public housing agencies across the country, in communities small and large, to apply to administer new housing choice vouchers on behalf of young adults that are exiting or recently exited foster care and are experiencing homelessness or at risk of experiencing homelessness. We are here today with our partners at the Administration for Children, Youth, and Families to stand up this initiative and work with you, our local partners, to make it a success. FYI would not be possible if it weren't for the advocacy of young people, current foster youth participants and alumni alike, that met with Secretary Carson and shared their proposal that is the bedrock of FYI. We thank them for their hard work. With that, I'll turn it over to Jerry Milner, the Associate Commissioner of the Administration of Children, Youth, and Families, or ACYF, at the U.S. Department of Health and Human Services to discuss the role and importance of our child welfare partners on this initiative. Through these joint endeavors, we can help to ensure that all young people who have had experiences with the child welfare system are given the opportunity to thrive in a safe, affordable housing. Jerry?
Thank you very much, Becky, and it's such a pleasure to be here with all of you today. The Children's Bureau is really quite excited to be partnering with HUD on this joint initiative, particularly when we think about the very poor outcomes that so many of our young people face when they age out of the foster care system. We have, in the Children's Bureau, been trying to promote a different way of thinking about child welfare and our foster care system, one that is really quite transformative from the more traditional ways that our systems have operated in. For far too long, the child welfare system has been operating in a way that often serve children and youth in the system in ways that do not address their well-being. We're focusing our efforts now on a much more preventative approach, one that sees parents of children and the families being the best resource for their children who in many situations just need additional supports in order to keep their families intact. However, even with our focus on prevention, we know that foster care will always be necessary to some extent, and we know that there will always be those situations when young people are unable to achieve permanency and unfortunately will leave the foster care system without the benefit of a permanent family. This is why we're so excited that HUD has seen this issue as a priority and has recognized the need for stable housing for young people who leave the foster care system. When our young people exit foster care without having permanency in their lives, without having the kinds of social supports that they need, they very often end up experiencing high rates of homelessness. They have greater chances of getting involved with the juvenile justice system and the adult criminal justice system, and overall may be at risk of having a lower quality of life in general. That's unacceptable to us. We think it's unacceptable when a young person who's been in our foster care system is expected to live as an adult when our system has failed to equip them with the necessary tools and resources to do so. Our young people aging out of foster care achieve poor outcomes when it comes to financial stability, especially when it comes to seeking stable housing. Many of our young people don't have the credit required or have less than great credit or are unable to financially pay the money needed up front, such as deposits for housing, utilities, moving expenses. They can easily find themselves taking out loans in order to cover these expenses. And once a young person finds themselves financially insecure, it's incredibly difficult for them to get on a path that leads them to financial stability. We are very much placing our full support into this initiative, and we are quite hopeful of the positive outcomes that we believe that will result because of this. We know that this initiative will not be successful unless strong partnership and collaboration is fostered between the public housing authorities and our public child welfare agencies. We're doing the work needed from our end to provide information to the public child welfare agency so that they are aware of this opportunity and aware of what they need to do in order to take full advantage of it. We've sent this information to our regional program offices of the Administration for Children and Families, who have requested to share it with states in their region. Our regional offices will also serve as liaisons between the states and the Children's Bureau and HUD as we move forward with this initiative. We're trying to increase the level of partnership across other federal agencies as well, and we're so pleased that this relationship and this partnership with HUD is one of our very early tangible results of those efforts. Both HUD and HHS serve many of the same children and families, and with greater and stronger partnerships between us, we truly have an opportunity to change the trajectory of the lives of so many young people who are leaving our foster care system without permanency in their lives. I just want to thank you again today for allowing me to be a part of this, for letting me share a little bit about the Children's Bureau's priorities, and now I'll turn things over to Kevin. Thank you very much.
Great. Thank you both for that important message and for your leadership. My name is Kevin Solarte, and I'm a Senior Program Manager for Federal Technical Assistance. And I've worked with HUD and HHS to address issues related to youth homelessness for about 10 years, and I'm excited to assist with this webinar today. So just a quick reminder that today's webinar is being recorded, and it will be posted on HUD's website along with the slide deck. All your phone lines are on mute today, but you can type your questions in the chat box, and we'll do our best to get through them at the end of today's session. And you can open the chat box by pressing the little chat bubble icon on your screen, and you can send those questions just to all participants. We also plan to have at least 15 minutes for questions and answers, and we'll also try to answer questions related to the presentation throughout. Now, I would like to do a quick poll to learn more about who we have on the call today. So if you look to the right of your screen, you will see a poll question asking you to describe which stakeholder group best describes you: Public Housing Authority, Public Child Welfare Agency, Continuum of Care, or other stakeholder. We'll give you about the next 30 seconds to complete the poll, and then the result will be shared on your screen. So if you could go ahead and click, and this helps us to better understand who we have on the webinar today in order to best address your questions throughout. All right, so in just a second, we should see, we're going to close the poll, and you should see the results coming up. Okay, so it looks like we have a decent amount from both the public housing, the PHAs, and the homeless system, and also a good amount from our child welfare system. So again, you can see the results on the right, and that'll help you see kind of who's on this webinar today. So thank you for taking that time to fill that out. Now I would like to run us through our agenda for today before turning it over to Ryan Jones from HUD's Office of Public and Indian Housing to dive into the details of the notice and the new Foster Youth to Independence initiative. Ryan will give us a brief introduction to FYI and then take us through FYI eligibility and program requirements, followed by a discussion on administering FYI. Then I will discuss partnership strategies and targeting strategies before we conclude with question and answer portion. With that, I will turn it over to Ryan Jones.
Thank you, Kevin, and thank you all for joining us today. As Kevin said, my name is Ryan Jones. I am a Senior Housing Program Specialist in the Housing Voucher Management and Operations Division within the Office of Public and Indian Housing. I am the policy lead for FYI, and I'm excited to talk to you today about the Foster Youth to Independence, or FYI, announced in Notice PIH 2019-20. FYI allows for public housing authorities that do not currently participate in the Family Unification Program to request tenant protection vouchers to serve FUP-eligible youth. These vouchers will be known as Foster Youth to Independence Tenant Protection Vouchers, or FYI TPVs for short. Through this initiative, HUD, in partnership with colleagues at HHS, specifically the Administration for Children and Families, we hope to address gaps in availability of FUP vouchers for youth around the country. We know that this is a limited resource, and the vast majority of FUP vouchers are going to serve families, the other eligible population under FUP. Recognizing that both populations are in need of this important resource, HUD hopes to increase access for youth through FYI, ensuring more housing options for youth 18 to 24 years old who have had experience with child welfare system and who are experiencing homelessness or at risk of homelessness. HUD also sees this new initiative as an important strategy that can be used to help local communities meet the federal goal of preventing and ending youth homelessness as outlined in Home Together, the federal strategic plan to end homelessness. Funding for the initiative utilizes appropriated funds for the tenant protection voucher. Requests for FYI TPVs will be accepted on a rolling basis under 3 conditions. 1, the availability of funding. 2, Notice PIH 2019-20 remains in effect. And 3, HUD continues to have the authority to use TPVs for this purpose. I also want to point out that the bottom of the slides reference the section of the notice that can be referenced for further detail. For example, the funding is explained further in Section 3 of the notice as referenced on the slide. Now I'd like to discuss eligibility and program requirements to give you all a better understanding of which youth qualify for this program and the eligibility and program requirements for participating public housing authorities and partnering public child welfare agencies. To start, which youth qualify for FYI TPVs? The youth must meet 3 qualifications. First, the youth must be at least 18 years of age and cannot be older than 24 years of age. 2, they must have been in the foster care at age 16 or older and have either left or are transitioning out of care within the next 90 days. 3, they must be experiencing homelessness or at risk of experiencing homelessness. It is important to note that youth who are couch surfing or unsafely doubled up may qualify. The terms at risk of homelessness and homeless are defined in the notice through regulatory reference. It is also important to note that youth who meet the above qualifications and are pregnant or parenting would qualify for FYI. Youth with children who have an open child welfare case may be eligible for family vouchers in communities where that resource is available. And now, what public housing authorities are eligible to request FYI TPVs, and what will be required of eligible PHAs requesting assistance for an eligible youth? To be eligible to request assistance through FYI, a PHA must currently be administering the Housing Choice Voucher Program and cannot be currently participating in FUP for families or youth. A list of eligible PHAs will be included on HUD's FYI webpage. These eligible PHAs will be required to enter into a partnership with a local public child welfare agency through an MOU or letter of intent. We'll talk more about this partnership in later slides. The PHA must also accept FYI eligible youth referrals from the local public child welfare agency, verify a youth eligibility for the Housing Choice Voucher Program, and update the PHA's administrative plan. Let's talk a little bit more about what the partnership agreement between a local public child welfare agency and a local public housing authority should look like. The agreement can be in the form of an MOU or a letter of intent and must, at a minimum, include the definition of FYI eligible youth as described in the notice, an outline of the supportive service requirements, including who will be providing the services to youth, and a description of the roles and responsibilities of each partner in administering FYI. The partnership agreement must, at a minimum, include the Public Child Welfare Agency and the Public Housing Authority. HUD strongly encourages including the local Continuum of Care, or COC, in the agreement as well, as we'll discuss the role the COC can play later in today's webinar. Public child welfare agencies entering into the partnership agreement will have a set of requirements in order to participate. First, they will need to create a process for identifying FYI eligible youth. This should include strategies to identify youth who may no longer be in contact with the agency and are experiencing homelessness or at high risk of experiencing homelessness. COCs and youth-serving agencies can be great partners in helping public child welfare agencies identify potential eligible youth. Second, public child welfare agencies should develop a system of prioritizing referrals based on need and the appropriateness of the intervention. Third, the public child welfare agency will need to verify that the identified youth have eligible child welfare history and provide a written certification to the Public Housing Authority along with the referral. Fourth, the Public Child Welfare Agency will need to either provide or secure partnerships that can provide up to 36 months of supportive services to the youth on the FYI TPV. A system for prioritization of the resource is highly recommended as the demand may outweigh the availability of the FYI TPVs. When developing prioritization policies, it is critical to consider both the needs of the eligible young people and the appropriateness of the intervention. For youth still in foster care and within 90 days of transitioning out of care, it is important for the local public child welfare agency to consider their permanency goals and their case plan when referring and prioritizing youth for FYI. Kevin will be talking to us later in the webinar on strategies local communities can use when thinking through about both the need and the appropriateness of the intervention to best prioritize and target FYI. The supportive services component, FYI, is critical to the success of the initiative. Let's take a couple minutes to discuss this component in a little more depth. The Public Child Welfare Agency is required to provide a set of supportive services or to secure them from a community partner. The services must be optional to youth, and they must be available for the full time the youth is being assisted with an FYI TPV, which can be up to 36 months. The required services are outlined in Section 6 of the notice and include 1, basic life skill supports that can assist a youth in living independently, 2, housing counseling to assist the youth in identifying housing and in the understanding of their housing rights and responsibilities, 3, landlord support services to help youth and landlords engage in successful relationships. 4, education and career development services that can assist a young person reach their higher education and or career training goals. And 5, employment and career services that can assist a young person in securing sustainable employment opportunities and move to self-sufficiency. Additional services can be offered to young people beyond the required services, and as Kevin will discuss later, it is recommended that additional services are offered if your community is going to target young people with high service needs, such as youth with complex mental and physical health needs or substance abuse issues. Before we move to an explanation of administering FYI, I want to take a few minutes to talk about the importance of including your local continuum of care in the FYI partnership. The local COC is a critical partner in identifying young people who are experiencing homelessness who may qualify for FYI. The COC can connect them back to the Public Child Welfare Agency for a potential referral to FYI. The COC can also connect youth to COC-funded services where eligible that can work in partnership with the FYI. Kevin will be talking more about this in the next section on the partnership strategies. Okay, now let's move on to how a PHA will administer assistance under FYI. The process starts with the triggering event of a public child welfare agency sending a referral to the PHA. A reminder that the local public child welfare agency is the only partner that is able to refer a young person to the public housing authority because they must certify the youth has an eligible child welfare history. However, partners like the COC can still assist in identifying potential eligible youth and connecting them to the child welfare agency for verification and referral to the PHA for FYI TPV assistance. The referral to the PHA is specific to youth by name and with written verification. The local child welfare agency can refer more than one youth at a time, but must list each name and provide written verification of eligibility for each youth. The PHA will then need to verify the youth being referred is eligible for the Housing Choice Voucher Program. PHA may not request FYI TPVs until the triggering event from the Public Child Welfare Agency. After the triggering event, there is a request process between the PHA and HUD. The PHA's executive director or equivalent must send an email request to FYITPV@HUD.gov, FYITPV@HUD.gov. For the full set of information needed in the body of the email, you can reference section 15 of the notice. I'll point out a few of the most important things that must be included. Certification of the partnership between the PHA and Public Child Welfare Agency and COC when applicable, description of who will provide the required supportive services, and a by-name list of the young people the PHA is requesting an FYI TPV for. The email will also need a completed Form HUD 52515. And I want to point out that HUD just made some changes to Form HUD 52515. As a result, while the Form HUD 52515 is still required, HUD only needs the first of the 2 pages completed of this revised form. To check if you're using the most current form, verify that the expiration date at the top right corner indicates an expiration date of 7/31/2022. Please reference section 15 of the notice for more guidance on what needs to be completed on this form. HUD will also be posting a sample email on the FYI homepage. Upon receipt of the request from the PHA, HUD will conduct an eligibility determination and process accordingly. While I expect the process request expeditiously, please note that if we receive a large volume of requests at one time, it may take us up to 60 business days to process. A PHA is able to request up to 25 FYI TPV vouchers in a fiscal year and can submit one request at a time or request for multiple vouchers with a by-name list of qualified youth. The request will be taken on a rolling basis. The value of the voucher are based on your PHA's per unit cost as determined by HUD. Before I turn it over to Kevin to talk about partnerships and targeting strategies, I want to share a few additional program requirements. FYI TPVs are time limited to 36 months. A youth that receives a FYI TPV can utilize assistance for a maximum of 36 months for that young person. The FYI TPV sunsets when the youth transitions off the voucher. They leave the program. This means the voucher is returned to HUD and does not remain with the PHA. Because the voucher does not remain with the PHA, FYI TPVs cannot be project-based. Because these vouchers are targeted to a specific eligible person, they must be used on that person. This also means that the assistance can be administered outside of the PHA waiting list. A PHA may admit a youth that is not on the PHA waiting list or without considering the family's waiting list position. These vouchers are also subject to reporting requirements in HUD's PIC and VMS software. As we move forward, please remember to type your questions into the chat box and we'll return them at the end of the webinar. With that, I will turn it back over to Kevin. Thank you.
All right. Thank you, Ryan, for all of that important information on administering foster youth independence. I would like to now shift us to talking about some strategies on forming the partnership in your community that can make FYI possible. One of the biggest tips we share with communities when starting to form these partnerships is to try and take the time to understand the mandates of your partner system and lens in which they operate. The child welfare system is tasked with ensuring the immediate safety, permanency, and well-being of children and youth who have experienced abuse or neglect by their primary caregiver. This is a really high-stress mission performed by workers who have the best interests of children and youth, especially their safety, at the forefront of their minds. The child welfare system also faces similar resource constraints as the public housing system and is also looking for opportunities to partner with and leverage other systems to improve services for children, youth, and families they serve. And the child welfare system recognizes the challenges facing youth who age out of foster care, as HHS leadership talked about earlier in the presentation, and the poor outcomes associated with vulnerable populations. The federal government has dedicated resources to extended foster care and other services in an attempt to improve these outcomes. Taking the time to understand your system's partner mission and in the context which they are doing the work helps to move us away from finger-pointing or blaming and towards a true collaboration rooted in mutual respect. The next tip is to try and build off the partnerships you currently have across your system. These may be at the client level or the system level, but either way, they can be leveraged to help you form a solid FYI partnership. For example, you may have programs within the housing and or homelessness system that are working together at the client level, serving the same youth and families. These casework level partnership can lead to strong relationships and success for youth and families. You can leverage these partnerships up to system leaders when trying to secure the required partnership for FYI. Similarly, system leaders may have strong partnerships through things like local, regional, and state level work groups that they're brought in to serve vulnerable youth and families. And often PHA directors and child welfare directors are asked to participate in these work groups or even to serve on continuum of care boards. Leveraging these existing relationships and success built into these established groups can be one great way to forge your FYI partnership. So once you've found that relationship to build upon and leverage, the next thing is really to try to gather the best data you have to help build the case as to why FYI partnerships are needed in your community. There are a few critical data sources to consider. First, you can approach your local continuum of care to analyze the data in the Homeless Information Management System, or HMIS. This data can help you understand how many young people experiencing homelessness are known to your system. In some communities, COCs are collecting data on child welfare history, meaning you may be able to make the local link between child welfare history and homelessness. If not, you can still see the scope of known youth homelessness and consider applying national averages for how many of those young people have child welfare history. We'll discuss this a little bit more in a bit later, but the national average usually estimate between 35 to 40% of youth experiencing homelessness have a child welfare history. You may also consider approaching your public child welfare agency to learn more about what the local data may be showing in what is called the National Youth in Transition Database. This data is based off of survey of young people while in care and then at several points after they have transitioned out of care. One of the questions asked is around experience of homelessness, and this can be a critical data source in understanding how many young people are struggling with housing in the years after they transition out of care. And lastly, you may also approach your local courts or local eviction filings for local eviction filings, which can help shed light on the amount of 18 to 24-year-olds that are struggling to retain housing in your community. although formal eviction filings do not give you a complete picture, they again can help make the case around the need for housing supports in your community for young people to retain housing. So, once you've established a relationship to leverage and you've explored your best data that you have, your community may consider digging into the goals of each of your partnering systems. In the case of the Public Housing Authority, the Public Child Welfare System, and the Homeless Response System, each system has goals around bettering the lives of youth that they serve. Your PHA may have a goal around increasing service options for youth to improve housing retention and self-sufficiency for young people in your housing. The Homeless Response System may have a goal to reduce the amount of 18 to 24-year-olds experiencing homelessness for the first time and to reduce the amount of time it takes to get a youth who is experiencing homelessness housed. And the local Public Child Welfare Agency may have a goal around helping young people reach permanency through stable housing and permanent connections, and to reduce the number of parenting youth of their children that come into the child welfare system. Though each of these goals are operating through a slightly different lens, there are common strings that can be pulled across all of the goals and therefore across all three systems. Helping each system partner see themselves in a joint system goal and see how that joint work can help them reach their own goals and mission will help ensure buy-in and sustainability in the FYI partnership. You may even consider creating a new cross-system goal like the one you see on the slide, a goal that touches a bit of each system goal and one that each system can track success in their own data over time to show the impact that it's having on improving their own system's goals. Now, we have talked a few times in the webinar about the importance of including the continuum of care, or the COC, in the FYI partnership, but I want to take a minute to highlight a few benefits of including the COC. The first is the utilization of coordinated entry system to identify young people who may be eligible and connect them to the Child Welfare Agency. Some young people with child welfare history do not experience homelessness until a year or several years after being out of the child welfare system. By this time, they may be disconnected from the child welfare worker. Using the coordinated entry system to identify these young people and get them reconnected to child welfare to verify and make the referral to the PHA can help ensure that some of the most vulnerable youth are accessing the resource. We want to be clear that using coordinated entry in this way does not mean that FYI TPVs, or tenant protection vouchers, have to use the same eligibility and prioritization as COC-funded projects. It can simply be a vehicle for identifying and connecting young people experiencing homelessness. It is an important point to stress that, again, the notice outlines what the actual eligibility for FYI TPVs are, and going through coordinated entry does not change that. The COC and coordinated entry can also help connect young people who are eligible for both FYI and COC-funded projects to both resources. For example, a young person may qualify for COC-funded rapid rehousing or permanent supportive housing. The COC can enroll the young person in this permanent housing project if they are prioritized in, and utilize the FYI TPV for up to 36 months of housing assistance, and the COC-funded project for the supportive services. This benefits youth and all the systems partnering by giving youth access to deeper levels of supportive services in the COC-funded project, while freeing up housing dollars in the project to serve more youth who may not be eligible for the TPV. Including the COC also helps to ensure that FYI is connected to your community's larger plan to prevent and end youth homelessness. FYI can play a critical tool as both a prevention tool for those youth that are at risk of homelessness, and as an intervention tool for those who are currently experiencing homelessness. Before we move on to targeting strategies, I would like to make one more point on the cross-system partnership in FYI, and that is that leveraging these partnerships and their success to do more and deeper strategies. This may include applying for future Family Unification Program, or FUP-NOFAs, or utilizing the partnership to improve your application for future rounds of the Youth Homelessness Demonstration Program, or it may mean using it to be more competitive for other local, state, or even public or private funding opportunities. The point really being around leveraging those partners for future opportunities. Now I'd like to move us to some strategies on targeting and prioritizing FYI resources to youth experiencing or at risk of experiencing homelessness in your community. To start, I want to stress why it is important to consider targeting and prioritizing strategies by pointing out what we know about the connection between child welfare history and homelessness. I'm going to talk about 3 statistics that we used often. The Midwest study followed more than 700 study participants when they were 17 or 18 through when they were age 26 as they transitioned out of foster care in 3 Midwestern states, Illinois, Iowa, and Wisconsin. And it found about 36% of those whose whereabouts were known experienced at least one episode of homelessness by age 26. And the National Youth Transition Database Survey, which we talked about earlier, of youth in foster care at age 17 and every 2 years post-exit until age 23, found that 43% of the about 5,500 youth who completed all 3 waves in the survey reported having a homelessness experience by the age of 21, and that was either at age 17, 19, or 21. And finally, the very recent Voices of Youth Count, which is a national survey of unaccompanied youth ages 13 to 25 who experienced some form of homelessness or housing instability, found that nearly 1/3 of the youth had experienced some form of involvement with the child welfare system in their lives. And this really held true in both urban and rural areas across the country. So these are some serious statistics that show us that there is a real need to target these critical resources to those youth who are experiencing homelessness or at risk of experiencing homelessness. In the next couple of slides, we'll offer a framework for your community to consider when targeting and prioritizing FYI in your community. I want to emphasize, though, that this is simply a framework to consider and that your community is free to target and prioritize the resource to any eligible youth in your community. This framework looks at national statistics we just covered and assumes that in any given community, about 35 to 40% of youth in a community with a child welfare history will be experiencing homelessness, and about 60 to 65% will not be experiencing homelessness. It then takes the homeless field's knowledge on youth homelessness and assumes that there will be a portion of young people experiencing homelessness with high-intensity service needs, and a portion of young people experiencing homelessness with low-intensity service needs. And we'll talk more about what the differences are between those high-intensity and low-intensity supportive service needs here in a minute. But similarly, there will be a portion who are not experiencing homelessness that will still have those high-intensity service needs, and those youth may be at high risk for future homelessness. And then the 4th group, there really will be a portion of young people who are not experiencing homelessness and will have a much lower service need. And these youth may be at a much lower risk of experiencing future homelessness. So, utilizing these national statistics and field knowledge, the framework creates 4 potential target groups for FYI. The first being youth experiencing homelessness with high-intensity support service needs. The second target group being youth experiencing homelessness with low-intensity supportive needs. The third being youth who are not experiencing homelessness but might have high-intensity supportive service needs. And the 4th group really being those youth who are not currently experiencing homelessness and that have low-intensity supportive service needs. In a few more slides, we will discuss what we mean by low-intensity service needs and high-intensity support service needs. But first, I want to offer a potential profile of young people who may fall into these 4 target groups, including their current living situation, their service needs, and their connection to the Public Child Welfare Agency. So youth in target group 1 and 2, and the 4 target groups are on the right hand of your screen, just to remind you what we mean when we say target groups 1 and 2. But these youth would be living, potentially would be living on places like the streets, in shelters or crisis housing. They may be at immediate danger of losing their housing, or they may be couch surfing. Based on their current living situation, youth in groups 1 and 2 may be less likely to still be in contact with their child welfare worker. The big difference between these two target groups, 1 and 2, is that youth in target group 1 may have a physical or mental health disability and may benefit from more frequent and more intensive supportive services, while youth in target group 2 may benefit from lighter touch services. So youth in target group 3 would really currently be living in a safe and stable housing, but may be at higher risk for housing instability that correlates with their high-intensity service needs. Young people in this group may be aging out of foster care, or they may be aged out and disconnected from their child welfare caseworker. Youth in target group 4, the last target group, would currently be in safe and stable housing and may be, again, at lower risk for housing instability that correlates with their low-intensive service needs. Young people in this group may be aging out of foster care, or again, they may be aged out and disconnected from the child welfare worker. So this kind of gives you a profile of who those 4 target groups, what young people's experiences might look like in those 4 target groups. Now, we have referenced the idea of high-intensity and low-intensity supportive service needs several times now, but what exactly are we referring to here? So, high-intensity support service needs refers to the need for more expensive or intensive types of interventions, such as clinical or evidence-based mental health or substance abuse interventions. These services may also be needed for a longer duration and would be provided in addition to the required services in the notice. While low-intensity supportive service needs refers to the need for more of the non-clinical services interventions that may really include many of the required services in the notice, such as life skills supports, education and employment supports, and they may only be needed on an occasional or light touch. So now we've taken some time to explain the 4 target groups in the framework and the logic behind the target groups how the target groups were formed. Now I want to shift to things your community might consider when deciding how to best target FYI in your community. So there are 2 main considerations in this framework for your community to look at when utilizing this framework. The first being the types and intensity of services your community can offer to FYI eligible youth, and the second is how those types and intensity of services match to the 4 target groups. This next slide gives you more details on how you can think about all the types of services and how they match in the context of the required services outlined in the notice and the set of additional services your community may or may not be able to offer, and how frequent and with what intensity your community can offer all of these services. So under FYI, target group 1, youth experiencing homelessness with high-intensity service needs, and target group 3, youth experiencing homelessness but with high-intensity service needs should be offered really all the required services listed in the notice. Again, I want to emphasize there is the required services that are listed in the notice, and then there's a set of additional services that your community might think through. So, those services include things, the required ones in the notice include things like your basic life skills training, your housing counseling, your landlord support services, employment and training, education and career services. Additionally, the youth identified in these 2 target groups could really benefit from other more intensive services, such as housing-based case management, mental health services, outpatient physical health services, substance abuse services, and legal services. So again, remembering that those target groups 1 and 3 really are those young people that may have those really higher intensity service needs. So for example, your community might offer case management once a month, all the required services in the notice, and additional services discussed at the frequency and the intensity that is desired by the youth. Whatever the model of service delivery your community chooses to implement, it's important to note that it's highly likely that youth in target group 1 and 3 will need more robust and frequent services than what is required in the notice. Target group 2, youth experiencing homelessness with low intensity service needs, and target group 4, youth not experiencing homelessness with low intensity service needs, must be offered all of the required services listed in the notice. And these required services should be offered, again, at the frequency and the intensity that is needed and that is desired by the young person. As a reminder, youth are not required to participate in supportive services provided under FYI in order to retain their housing. It is likely that youth in target group 2 and 4 will only need assistance across a few of the required service options and at a lower frequency. Okay. So, based on all this information, how might your community use this targeting framework to develop prioritization strategies for FYI? Remember, the notice states that prioritization should be based on both the need and the appropriateness of the intervention. This framework can help your community make local decisions on what target groups your local FYI program is best equipped to serve and prioritize based on the appropriate level of housing and services and on the most immediate need. For example, if your community can offer all of the required supportive services listed in the notice, along with additional services options outlined in the previous slides at as much frequency and intensity as the youth may need, then it might consider serving target group 1, those that are experiencing homelessness with high intensity service needs, and target group 3, those who are not currently experiencing homelessness but might be at a higher risk in correlation with their service needs. And among these target groups, you might consider prioritizing young people in group 1 because these young people have a high intensity service need that can be appropriately matched with the services you have available, and a voucher and a more immediate housing need due to their current homelessness. Similarly, if your community can offer all of the required supportive services listed in the notice, but can't at this time offer a deeper array of services, then it might consider serving target group 2, those experiencing homelessness with low intensity service needs, and target group 4, youth who are not currently experiencing homelessness with low intensity service needs. And you might consider prioritizing target group 2 because these young people have a low intensity service need that can be appropriately matched with the services that you have available in a voucher, and more immediate housing need due to their current homelessness. With the limited resource of FYI, your community will need to consider if serving target group 4, youth who are not currently experiencing homelessness and have low service needs, is the most strategic use of your resource. Again, I want to stress this information is only meant to offer a suggested framework when trying to target and prioritize a limited resource. Your community can choose to serve any eligible youth and can determine your own targeting and your own prioritization strategies using the prioritization language that's in the notice. Also a reminder that partnerships with your COC are critical to identifying young people in these target groups who are experiencing homelessness and who may no longer be connected to the child welfare worker. These young people may also qualify for COC services, which can assist in offering higher intensity services. Medicaid partnerships may be another way to help young people with high intensity service needs access services. The big theme here is being the power of partnerships within FYI. With that, Ryan and I, along with Jerry Milner's policy advisor, Jeremy Long, will take some of the questions that you all have typed into the chat box. So just give us 1 second here, and we are going to do our best to go through and look at the full array of questions that you all have sent and get to as many as we can. But I do want to stress, if we don't get to them today, or if it's not a question you've seen answered, please go to the link here for the frequently asked questions on the FYI website. And you could also email your questions to fyitpv@hud.gov. But we do have till about 4:15 Eastern time, so we're going to go ahead and try to get through as many of the questions as we can. So I'm going to start as close to the top as I can, and with some of the big questions. One of them being, and maybe this is one that HHS folks can answer, but if there's any kind of thoughts or advice on the ways that public child welfare agencies can access or get the types of services that are required for this type of partnership.
Hey everybody, thanks Kevin. This is Jeremy Long with the Children's Bureau. And we definitely understand that there's some thinking and some collaboration that definitely has to go on here in order to identify those types of services and supports that are, one, required in the notice, and two, just things that young people need. But one opportunity is for Chafee funds to be utilized for the services for these young people. But I think the biggest takeaway around this is the conversations that need to be had in the local communities between the public housing authorities and the child welfare agencies to identify what supports the young person needs, and then who is able to provide them. There's also opportunities for the continuums of care to provide some of those services and support. So there isn't an overarching answer that's going to provide those services to all young people in the communities, at least from the HHS side, but it's definitely important to have those conversations in the local communities and figuring out what that looks like between the two to provide those services and supports to those young people.
Great, thank you. Another question more on the technical side that maybe some of the HUD folks can answer is around who exactly can apply or ask for FYI TPV vouchers.
Hey, Kevin, this is Ryan. So the entity that can apply to administer the FYI TPVs are PHAs that currently administer the Housing Choice Voucher Program. So these are PHAs that have an existing ACC or Annual Contributions Contract with HUD for Housing Choice Vouchers. A contract administrator that does not have an ACC or Annual Contributions Contract with HUD for HCVs but constitutes a PHA under 24 CFR 982.4 by reason of administering HCVs on behalf of another PHA is not eligible to submit an application under this notice. So those that are eligible are those PHAs, so only public housing authorities that administer Housing Choice Voucher Program. They have an ACC with HUD to administer the Housing Choice Voucher Program.
Great, and similarly, there's been several questions, Ryan, around what does this do in terms of if you request FYI vouchers, in terms of your future opportunities to apply for FUP vouchers under any new NOFAs that might come out?
So requesting and receiving assistance under FYI TPV does not impact your ability to request assistance under a future Family Unification Program notice of funding availability.
Great, thank you. And so similarly, there's been several questions around on the service side of things in terms of does it have to be the Public Child Welfare Agency that actually provides the services, or can other partnering organizations such as even the PHA or community-based organizations provide those required supportive services in the notice?
So I'll say this is Ryan. From HUD's perspective, we just want to see that those services provided. Whoever is identified to provide those services, that is okay with us. So we tried not to be too specific there. In some cases, maybe it is the PHA. Maybe they have some funds that are available to them to provide these services. Maybe these are some services they already provide to other participants in their program. Maybe they have some other partnerships. That's great. As long as the services have been provided and the applicant can identify who is providing those services, then we're okay on our end. Great,
thank you. And there's been several questions also around, if I'm interpreting the question right, I think it's asking can they be applied to a specific project that might be, if I had to assume a question around can these vouchers be project-based?
As a result of these vouchers sunsetting when the youth leaves the program, the PHAs are prohibited from project-basing the assistance provided under the notice. Well, you know, if there's a project that maybe is desirable for young persons, it's already passed an inspection, and a young person chooses to use their tenant-based assistance to lease up at that project, that's okay, but these vouchers cannot be project-based.
Great, thank you. There's also been several questions around young people that might have both a child welfare history and a criminal justice history, and if young people with a criminal background would qualify still for these vouchers or not.
I would discuss with my local public housing authority to understand what federal restrictions are in place in terms of their background and whatever administrative policies that PHA has in place that may or may not impact that young person's ability to participate in the program. These young people should not be treated any differently than any other individual or family that would be applying for or receiving assistance under their Housing Choice Voucher program.
Great. Thank you, Ryan. Sorry, lots of technical questions, Ryan. So I'm going to keep throwing them the HUD's direction. The next one I see on here is there any administrative funds associated with these vouchers?
HUD, the administrative fees that would apply to a regular Housing Choice Voucher program would be provided in this case.
Great. Thank you. Another technical one, can the FYI voucher be allowed to use portability to other jurisdictions?
Yes, this is Ryan again. We can send some other way. So yes, a young person can port to another PHA, just as they can with the Family Unification Program, and that agency they are porting to does not have to have requested FYI or unrelated have a family unification program. So if a young person desires to port within the requirements that allows them to port, they can do so.
Great. So there was a question on recommendations for basic language or resource webpage for lay people that can help them figure out if this is something they could and should seek out in their communities. So HUD does have a landing page for the FYI initiative and working on getting several documents out that explain in more lay language what exactly this initiative is. So kind of stay tuned for those documents to be coming out very soon that hopefully your community can use kind of more as a one-pager explanation when you are approaching, whether you're a PHA approaching your child welfare agency or vice versa. Hopefully these documents coming out will help you think about how you get this partnership started in your community. So there was a couple kind of more broad questions on the targeting piece of this and prioritization. Again, I want to emphasize kind of what we went through in the end was one way for your community to think about the different groupings of young people that all qualify as long as they meet those eligibility requirements that Ryan discussed and that are outlined in the notice, but that you have the ability to do that in your community based on the need in your community. And there is specifically prioritization language, so there was a question around who's going to set prioritization for this initiative. And again, specifically, if you look in the notice, and I'll turn it to you, Ryan, in a second to remind me what section of the notice actually has the language. But in the notice, it does talk about how the Child Welfare Agency should be looking when prioritizing, be looking at both the need and the appropriateness of the intervention. And so how that is determined really is up to the partnership between the Child Welfare Agency and the Housing Authority. And can you remind me, Ryan, what section that language is in the notice?
Yeah, absolutely. So if you're looking at the notice, you would be looking at page 7 and section 13. It starts with prioritization.
Great. Thank you. And there's been a couple questions around the length of these vouchers and the services. So again, just reemphasizing that the voucher can offer up to 36 months of rental assistance, and that the services would have to be available for up to that full 36 months. Knowing that some young people, may transition to kind of self-sufficiency before 36 months, and some may stay on longer. And so another question that I'll turn to you, maybe Ryan, is after that 36 months, if a young person still needed rental assistance, what type of vouchers or availability are they to transfer to other types of vouchers?
A PHA does have the option, if they would like, to set a waiting list preference for their young people that would be exiting the FYI TPV program. So that's a flexibility that the local PHA has to set their priorities for their waiting list. And so it would be the young person would have to be pulled from the waiting list based on that prioritization if PHA does decide that, in whatever circumstances that they would like to continue to provide housing assistance to that young person. So again, a PHA has the ability to set their local preferences for their waiting list, and they could establish a preference for young persons that are coming to the end of their 36 months of assistance and do not have other housing options available to them.
Thank you. One that just came in is, can youth aging out of foster care come from other places, or do they have to be from the PHA's jurisdiction, meaning city, county, or state? So again, I think the question's asking if a young person may be living in one state or jurisdiction currently, but actually experience foster care in another state, would they still qualify, or could they still be served by that PHA?
I apologize, can you ask that one more time?
Sure, and I think this, I can take a stab at this one as well. I think really what they're asking, if the folks are asking, is if you experienced child welfare, let's say in New York, but you're currently living in New Jersey, but you qualified, could you be served by that PHA? I think the big thing to remember here, right, is that the triggering event that Ryan talked about, and the fact that the child welfare agency that you have the partnership agreement with has to be the one that requests kind of sends the verification to the PHA. So I think in the larger scheme of things, and Ryan kind of chime in if I'm getting this wrong, but I think in the larger scheme of things, yes, it is possible, but you would have to have the kind of partnership in place and the ability to actually still verify that that young person had in fact experienced the eligible child welfare history and have a way to verify that so that the PHA could then request the voucher from HUD. Does that sound correct to you, Ryan?
That does, thank you. And I also want to just plug again the slide that's in front of you now. It points to a web page on HUD, a HUD web page with frequently asked questions. So the questions that we're fielding now and the ones that we have not been able to get to, we'll be updating that document with these questions. So be on the lookout for those updates in the future.
Thank you. So another question came in terms of, do you have to apply for a TPV when you have a specific young person in mind and just reapply every time you think you have an eligible youth? Yes. So that, as Ryan stated, it has to be specific to a by name, for lack of better phrasing, by name list of youth. So that could be one young person at a time. It could be multiple young people at a time, but you do have to, it has to be an individual, linked to an individual eligible young person with verification from the Public Child Welfare Agency that that young person has the child welfare history required. So that could look like your PHA sending one request every couple months. It could look like sending one request that has 5 or 6 specific names on it. Anything else you would add to that, Ryan?
No, that's right. We have seen some questions say, how few can I request? And, the answer can be one, or, we could have a community that is coming together, after this meeting, after this webinar, and looks at their, their child welfare system, and then it looks, within their homelessness system and their coordinated entry, and, youth that have been identified. They may already have a list of 25 young persons that would be eligible for this program, and they could submit an application to HUD with the list of the 25, or again, if they're just getting started or they just have one at this time, we would accept that as well, and then they could come back throughout the year as they identify more young persons that could be serviced with this program.
Great. And is there any deadline for submission, Ryan?
No, there is no deadline for the submission. If you're looking at the notice, and I think there was a question also of how you can find this notice. So let me answer that question and inform people how to access the notice that we've been referring to. But if you're looking at the notice, in Section 3, it talks about the funding. And so there is not a hard deadline. There are some caveats that I covered previously, and that is that applications can continue to come in. We'll continue to make awards as long as funding remains available. This notice remains in effect, and HUD continues to have the authority to make TPVs available for this purpose. So I would note, so there were questions, how can I find this notice? If you do a search for PIH Notice 2019-20, it should be probably the top search result that you get. So the link to a HUD Public Indian Housing webpage that you can access for this notice.
And also, Amber put it in the chat box, and I'll ask you, Amber, to just put it back at the bottom of the chat box so people can see it again, but the actual link to the notice as well. So if you didn't get that as Ryan was stating it, we'll put it in the chat box, the link to the notice. And just remember, these slides and recording will also be posted, so you'll have access to all of this to make sure you have a reference point. So we have time for probably 2 or 3 more questions at the most. So if your question hasn't got answered, make sure or you have a burning question, please make sure to type into the box. But I will answer a couple more that I've seen come through. And so one of the things that has come up is the timeline around this of when is assistance actually available through FYI. And so the answer there really is as soon as your public housing authority and your child welfare agency, public child welfare agency, have a signed agreement, whether that's a MOU or a letter of intent, as Ryan described, as soon as that is in place, you and your child welfare agency has the triggering event of sending the public housing authority a name of a young person who qualifies and needs the assistance. You can start requesting that assistance from HUD immediately using the process that was outlined by Ryan. So again, I think it is hard to say an exact timeline because it really is dependent on in your local community, your housing authority, and your child welfare agency's ability to come to a partnership agreement through an MOU or a letter of intent and start requesting those vouchers, those FYI TPVs directly from HUD. There was a question, Ryan, that came in on if HUD will be able to offer any sample MOU or letter of intent, if that is something that is being considered.
Yes, that is something that we're considering and we'll be working on. When we have completed that, we'll be adding that to our FYI webpage. We have received some requests, and so we are interested in providing that to you. Just give us a little bit of time, and we'll provide some samples for you.
Great. All right. For my other panelists on there, any other burning questions that you've seen come into the chat box that you would like us to answer, or if, again, any of the folks that are still on the webinar, if there's anything we haven't answered, you can go ahead and chat those into the chat box. We probably have a time for about 1 or 2 more questions at the very most.
Hey, this is Jeremy with the Children's Bureau, and I've seen a couple questions regarding states that have extended federal foster care and the young people that are in those programs. And I just want to say that young people that are in extended federal foster care technically wouldn't be young people who have aged out of the system, so they technically wouldn't be eligible for the housing vouchers. However, there is the part of the notice that talks about if the young person is getting ready to age out of foster care within 90 days and may experience housing instability, that they may be eligible. But any young person that's receiving services and supports through extended federal foster care, more often than not, that includes housing and education and independent living support. So the housing vouchers wouldn't be a necessity for them.
Thank you, Jeremy. That's a great point. Thank you. And I think a couple other just kind of technical questions came in I think we have time to get to, and that is just to clarify, that is 25 vouchers can be requested in any fiscal year. So correct, Ryan, so if you had 25 in a fiscal year, a new fiscal year started, a PHA could request more in that next fiscal year, is that correct?
Yes, as long as Section 3 of the notice continues to, so as long as the notice continues to be in force, and those items that I outlined in Section 3 that continues to be the case, then yes, they can come in and request the additional vouchers in the forthcoming year.
Great. And a couple questions have come in around kind of transferring the vouchers to another youth in the area. And just to clarify again, and I'll ask Ryan you to correct me if this is wrong, but when a young person leaves that voucher for any reason, whether it be an unfortunate eviction or because they have reached self-sufficiency, the voucher does in fact go back to HUD, and so the PHA would have to request the voucher again for another eligible young person. Is that correct?
That is correct. So if they have not reached their cap of 25 vouchers in that year, or award of new vouchers in that year, then they could come in on behalf of another eligible person and request assistance on behalf of that person. Great.
Thank you. Any for the rest of the panelists on, any other burning questions that you want us to answer before we end?
This is Ryan. I just want to, there's another question on whether the youth is required to participate in the services. I want to say no. They have the choice to accept or participate in the services, and that cannot impact their continued eligibility to participate and receive the assistance.
Great. Thank you. Well, I think hopefully we have gotten to the majority of all of your questions. Again, I just want to remind you to look at the links on the slide in front of you in terms of where you can find the FAQ document that will also be updated with some of the questions that we have here today, as well as you are free to email questions directly to the FYI tpv@hud.gov. Again, that's FYI tpv@hud.gov for any questions that were not covered today or that you don't see in the frequently asked questions document listed on this screen. Anything else from you, Ryan?
No, thank you. Nothing else here. We will continue to be engaged in our communities. For our public housing authorities, you may hear from our Office of Field Operations, from the field office directors or other members of our team, and moving forward to continue to support you in this effort. We'll continue to make updates on the FYI webpage as we're learning more things, to be able to share ideas, to answer FAQs. We continue to be available to help make this a success for you and the community, and look forward to working with everyone moving forward. We really appreciate our partnership with HHS and the partnership with our local PHA, child welfare, and homelessness system providers.
Thank you very much, everyone.